Hello and welcome to Thinkermaker. We're going to explore the National Health Service and that aspect of life called healthcare. But unlike most other healthcare reports, in addition to the health part, we're going to focus just as much on the care part. And do feel free to pause and read the slides anytime. Often we find people saying these are the big key questions for getting the NHS right. Prevention or cure. Centralised or localised. Privatise, nationalise or reorganise. Efficiency versus waste. These questions have been asked before and take us in circles. In truth, none of these things are the key questions right now because they focus too much on the health and not enough on the care. The right key questions will capture both. The key question is something altogether different, which is why, for all their merit, documents like these current grand plans have an enormous gap arising from an inherited management culture that became mantra about 25 years ago. I'm going to demonstrate that we've cornered ourselves into placing far too much importance on factors which science knows how to measure as a health metric, simply because they're measurable. Strategies have neglected to regard quality care precisely because its essential ingredients are empathy and compassion, which are not measurable. And to be clear, time or minutes of hand-holding is no measure of sincere compassion. So this is what it's all about. Love. Some of you may cringe as I say it. Don't. If you do, then you are part of the problem. Care is a form of love. Health is an aspect of life that's laden with intense emotion and feeling. Pain of body or mind. Embarrassment. Fear. Relief. Grief. Hope. Anxiety. Managing emotions well requires care. I'll say it again. Care is a form of love. Look, someone collapsed. This chap cares, but he is indifferent. How do you objectively measure his indifference? Science can't, but a haphazard approach to caringness is unacceptable. It actually has enormous impact on the bottom line, and I will come to that. But first, note that it is emotion that impels us to tell each other our NHS stories and drive us to do something about them. And there's an elephant in the room, and it is the key question, which this presentation will reveal. You will see that the care part is the more urgent part in the NHS at this time, neglected, all because care is not truly measurable by today's science methods. But first, a quick run through some history of the last 25 years in the NHS. So after the NHS was launched in 1948, its costs grew at a steady rate till about 1990, when suddenly costs mushroomed, which prompted then Prime Minister Margaret Thatcher's government to investigate where all the cash was going. And at that time, a certain medical student was on a second floor obstetric labour ward, learning how to manage a pregnant woman and deliver a baby. Now, while waiting for her to start labour, he opened a window for fresh air, looked out, and noticed another window open in the room next door with boxes being thrown out and men down below catching and loading them into a van. With the matron, he went to that room to investigate. It was the nappy store. And the pregnant woman's husband was throwing boxes of nappies out of the window for this expected baby. And when confronted, he protested he was doing nothing wrong as he had paid his taxes. This was a typical mentality of that time. Even staff pilfered items like these. Crutches were not returned. And all this was just tip of the iceberg. No one in the NHS was keeping tabs, and something had to be done. The new culture that was imposed brought an essential lurch towards prioritising costs over the next 25 years. And this ushered in the management experts and Quangos and their methods and concepts of bottom line focused counting of anything that can be counted. Concepts like bed stay days, for example. But consider this: if I forced you to hold someone's hand for an hour, especially if you don't want to, then can we say any compassion was delivered by the hand-holding? Of course, the answer is no. Compassion is not measurable. So, with this pendulum swing toward cost focus, something essential to health care got lost. We threw the baby out with the bathwater. In their wisdom, those management experts restructured the NHS from its 1948 shape to this in the 1990s, but that didn't work. So then again to this in the early 2000s. Indeed, in 20 years, from the 90s to 2012, the NHS got restructured no less than 6 times, about once every 3 years. How would you like it if I rearranged the rooms of your house every 3 years? Like this. And again. And again. And again. Now that's much better, isn't it? Do you think after a few years you'd even know where to find your TV remote control? The reason why this awful mayhem happens is rooted in the problem of our modern runaway bias in favour of measuring and counting things using logic. But too often the logic is based on seriously flawed assumptions, especially for phenomena which cannot be measured, like emotion. Categories like postcodes may conveniently suit systems, but often do not match human emotional care needs. A key question is, should we expect humans to fit systems, or design systems to fit the human, an emotional animal? With that culture, successive governments picked headline-grabbing but foolish metrics as benchmarks for healthcare, such as an artificial separation of hospital health outcomes from community health outcomes. It seems logical, but they are artificial categories to suit systems, not humans. Quite foolish. Let's see why. Take these hospital managers here, who've been tasked with improving poor waiting time stats for a common tummy operation. Usually, most patients get better without problems, but a few bleed the day after the operation and are kept an extra day for it to stop. But because we can't predict who'll bleed, everyone is sent home on the 3rd day, which is when beds are freed up. The managers chasing stats realised the odds of bleeding at home are lower and waiting lists would reduce if, by sending patients home on day 2, beds were freed up earlier, and they also logically assumed that any bleeding at home could be cared for in the community. But of course, this just transferred the problem and cost to community health managers, the other category in the system. And that just creates poor metrics in community health instead. Too often, one system category is blind to another. One metric is blind to another. In the next episode, we'll see how managers, even with tons of funding, have made a total fiasco and utterly squandered resources. Billions. Thank you for watching.